Many pet owners may not be aware just how dangerous the paralysis tick can be for their dog or their cat. Today we're going to meet Dr. Ben Brown and Bamboo to hear just how deadly the paralysis tick can be.
Hi Lara.
Hi Ben, I'm good, how are you?
Good, good, come on through.
We're going to meet little Bamboo today. Ben, a lot of people might not realise how many states the paralysis tick is actually found in.
Yeah, that's correct, Lara. The paralysis tick is found down the eastern seaboard of Australia. So from Queensland right down to Tasmania in some cases as well, there's paralysis tick. And it seems to favour areas where there's high rainfall, high humidity, typically from that sort of August, September period through till maybe February.
Okay.
Tends to be the peak time that we see cases of tick paralysis.
Okay. Now, of course, yes, we're coming to you. Bamboo's got a pretty bad story. What happened to him?
Yeah, poor Bamboo suffered from tick paralysis last season. Okay, so Bamboo came to see me struggling to breathe, unable to walk, really in a bad way. The owners were very, very concerned.
Yes.
Bamboo suffered from high-grade tick paralysis, meaning that the back legs and the front legs were completely paralysed, and even Bamboo's ability to swallow was paralysed as well. One of the things that tick paralysis can do in addition to that is actually cause nausea and vomiting. So Bamboo was vomiting and then wasn't able to swallow properly and developed aspiration pneumonia, which is where the vomit goes down into their lungs and causes a serious life-threatening infection. So Bamboo was very, very sick and required 4 days of hospitalisation, oxygen therapy, IV antibiotics, and some significant intensive care to save Bamboo's life.
How do you deal with the paralysis?
So the paralysis is not something that there is a quick fix for. We need to give tick anti-serum to neutralise the tick poison that's in their system to prevent them from getting dramatically worse, but they actually need to produce new nerve receptors at the site where they've been poisoned, and that takes a number of days. So we just have to provide really good nursing care, really good medical care, turning them frequently, even things like lubricating their eyes so they don't develop corneal ulcers, because they actually lose the ability to blink in severe cases. So really good nursing care from our amazing team helps to get these little dogs through.
So what should people be doing if they think they're going to a tick area or even just in general?
Well, first and foremost, make sure your dog's on tick prevention. Okay. One of the newer tick preventatives, the oral tick preventatives or the newer tick collars, are the most effective at preventing tick paralysis. The other thing to do is make sure you tick search your pet daily. So that involves going through the coat, really feeling their skin for any little bump that might be a tick. If you notice a tick, checking the ears, in the nose, on the edges of the eye. Most ticks can be found from the shoulders forward. So particularly focusing on those areas. If you do notice a tick, head down to your vet straight away and have it removed.
Yeah, absolutely, because it can be very painful and life-threatening.
It can be, particularly if your dog's not on tick prevention.
Lovely. Thank you, Ben.
No worries, my pleasure.
Glad you're doing okay, doing all right now?
Yeah, doing amazingly well now. Yeah, back to normal.
Oh, great to hear. Close call, buddy. Yeah.
A monthly Chew Light NexGard Spectra can protect your dog from the deadly paralysis tick as well as other ticks, fleas and worms. So make sure your dog is protected no matter where you live.